So for our core multidisciplinary rebuttal components, we're doing a psychological review, okay? If the psychological diagnosis, psychiatric diagnosis on file, it seems reasonable, we leave it alone. We don't have to do a full psych assessment, in other words. We do comprehensive analyses, though, of the remuneration, the socioeconomic status, and the training. So the occupations that are being put forward, are these actual skills the person has here and now, or are these things that they could acquire potentially 2 to 3 years down the road? We strike out occupation on that basis. What about remuneration? If the person's jobs that are being suggested, that famous parking lot attendant, you know, other than people who are had minimum wage jobs before, if you're putting forth minimum wage jobs for the IE, post-104 IE, chances are there's going to be a significant wage loss that will be recognized that may in of itself meet the post-104 criterion. Same with the socioeconomic status that we talked about. We do the multi-day situational work assessment to actually identify, again, look at their current aptitudes, because it will generate that for us, as well as their stamina, their productivity, their pace, how many breaks they take, are they being tearful, can they manage, do they keep things together, would they be able to, you know, interpersonally relate to folks, would they be able to, you know, react spontaneously in crisis situations if the jobs involve that kind of requirement. We always recommend medical assessments parallel to the IE because obviously even though medical specialists really don't carry as much true weight in terms of identifying or evaluating how a person is going to function in a job, obviously we're still going to need to make sure that there are going to be impairments that are MVA related, the causality piece is going to be there, and ultimately we want them agreeing with the multi-day situational work assessment. So if we conclude the person's unable to do these occupations because of their demonstrated pain, emotional symptoms, cognitive symptoms, we want the medical people to basically say, yes, I've viewed the situational, and I concur that from my own orthopedic perspective, yes, there are soft tissue injuries that contribute to that overall finding by the situational work assessment. Okay. And then as indicated, let's say we have a psychological IE on file before that said the person had a more mild diagnosis, like maybe an adjustment disorder or no impairment at all. And if at the end of the day our situational work assessment says, no, there is an occupational disability here, the person can't do any occupation, including the ones that we very specifically measured that the IE gave us, well, if there's no psychological assessment on file with the IE saying there is a pain disorder, is a major depression, well, at that point, if we need that, we have to kind of fill in that gap, that diagnostic gap. Then we would recommend doing a psychological assessment. So again, the psychological assessment can chime in and say, the multi-day situational assessment, recognize these pain-related issues, there is a pain disorder here, found that the person was breaking down in tears fairly frequently, there is a major depression here. You get the idea. Basically, we want to be able to put a nice ribbon around everything and say that the impairments and limitations identified in the situational assessment have a medical basis and or a psychiatric, psychological basis to them.